Hi everyone, my name is Ibrahim. I'm one of the internal medicine trainees working in the NHS UK. I welcome you back again in this video, which is the third installment explaining United Kingdom Foundation Program for international medical graduates. In our first video, which you can find here, Dr. Ibrahim have explained what is United Kingdom Foundation Program and whether an IMG can apply and which IMGs can apply. In the second video, I have explained about the eligibility and the timeline of application for the whole process. In this video, I'm going to more focus on the exams that you have to take as a part of this process and how much money you'll have to put down for this entire process to start working as a foundation doctor in the UK. Let's get started.
If this is the first time you're checking out our channel, welcome. Basically what we do is we run a website that's totally free known as roadtok.com, and it will explain the ins and outs about everything related to the United Kingdom and what it takes for you to work as a doctor in the NHS. So if you've not already, please stalk us on all of our social media. Find us on Facebook, find us on Twitter, Instagram, and of course YouTube. Don't forget to subscribe.
So here we go, we have started this series for a complete guidance to apply for a 2-year foundation program, which is the internship of the doctors in the United Kingdom and how international medical graduates around the world can start doing this. So the first question a lot of people might ask at this point of watching this third video is, do you need IELTS or OET to join UKFP? So I'll run you down 3 questions, and if the answer to all of these 3 questions is yes, then probably you will not need IELTS or OET to join UKFP. So the 3 questions are, was your entire primary medical qualification taught solely in English? Was all examinations during your primary medical qualification was taken in English? Did at least 75% of the patient interactions during PMQ was in English? If I'm talking about my primary medical qualification as an international medical graduate, my primary medical graduate was completely taught in English. Exams were taught in English. But graduating from a non-English speaking country, I cannot prove that 75% of the interaction was in English. So if I was in your shoes that I want to join UKFP, probably I wouldn't be able to use my primary medical qualification as a proof of English language. I would have to take IELTS or OET to gain provisional GMC registration or just to even apply for UKFPO Foundation program. The next question is, do I need PLAB to join UKFP? There's only one question. If you are a graduate from a UK or EEA country. If you are not a graduate from an UK or EEA country, you would have to take PLAB to join UKFP, because PLAB is the process that you'll have to take for getting GMC provisional registration. So that process should run alongside the whole application process of United Kingdom Foundation Program. So you'd have to take PLAB if you graduated from a country outside UK or European Economic Area. So what are the exams to take as to join UKFP? Obviously, we have established if you need it, you'd have to take IELTS and OET. And the requirement for IELTS and OET we've already discussed. Just to reiterate here, you need at least 7.5 in all modules in IELTS or 400 in all modules in OET, and you have to pass it before the eligibility application window of the application year, which is around July, August. So please note that the requirement for IELTS and OET is a bit higher than what is the general requirement for GMC registration. Because it's UKFPO, that's why the requirement is a bit different. Second exam in the list is PLAB 1. You have to take PLAB 1, which you have to pass before the ending January, because as you'll be starting the job in August of the year of training, in that year by January you have to pass PLAB 1, because you have to be able to take PLAB 2 before the August starts. So to give you ample of time to book and take and get GMC registration, you have to pass PLAB 1 before January. And I think the January result, the last date would be actually taking PLAB 1 during November, which you have discussed in the previous video where I have detailed showing you a calendar when you can apply and when you have to take those exams. And importantly, the scores in PLAB 1 does not matter in this whole application process. You just have to pass PLAB 1. The next in the list is SJT, which is called Situational Judgment Test. In this test, you have to pass, and the scores matter a lot in ranking because the score is 50 out of 50. How much you score will determine how well you have done, and your preferences will be given priority because if you score higher, your rank will be higher. The next exam is PLAB 2. You'll have to take PLAB 2 as a part of the whole process to gain GMC registration, and you have to pass it before ending April to give you ample of time to provide, to apply for GMC registration and obtain GMC registration, and they give you time to apply for visa and start the training program in August of that training year. If there is some problem with the whole application process, if there is a delay of the exam, UKFP is considerate to defer the start date from August, but that obviously is case by case, individual basis. But this is the general timeline that you have to do it. Let's talk a bit more about situational judgment test. This is probably something new you have heard about the whole pathway. This is only needed if you're joining any training program under UKFP. If you're joining UKFPO from FY1, which we are talking about, you'll have to take SJT. You'll also have to take SJT if you're applying for FY2 standalone program when you already have obtained full GMC registration by taking PLAB and you want to join FY2 standalone. You'll also have to take situational judgment test. So what is situational judgment test? It's a computerized based assessment. I mean, it's taken online these days as well, and this exam is mainly focused on situations and judging how focused are you on patient safety and your professionalism more than what you know clinically. So it's mainly based on the communication skills and team working skills that you have. And the exam is actually structured with two types of questions. One is ranking, like you will be given 5 options on a situation, and you'll have to rank which is the most appropriate first and which is the least appropriate according to what you think. And also you'll be given some multiple choice questions. You'll be given like 7 or 6 choices, and you'll be asked to choose only 3 questions. Let's run you through some example questions because UKFPO website has some practice papers, and there's plethora of practice questions available on the internet. You can collect those to prepare for this exam. You need a basic understanding of how the UK medical care is provided, and it's as I said, it's more of a test of your professionalism and communication and understanding of the healthcare system rather than what you know academically or clinically. So let's run you through an example question, how the questions are in situational judgment test. So this is a situation that's given. Your consultant has to attend a patient on another ward. In her absence, she asks you to liaise with the radiology department to arrange an urgent CT scan for Mrs. Lewis. You request to book the test but are contacted by the radiologist a few hours later. He informs you that they rejected your request on the basis of insufficient information. That can happen many times as a junior doctor in the UK, and the question asks to rank in order of the appropriateness of the following actions in response to the situation, and the actions are like this. So it's your task now to choose which is the most appropriate. That would be the first thing, and based on appropriateness you have to make a rank. So let's run through the options here. Number A is send the CT scan request to another radiologist, is ask the radiologist to explain in more detail what was missing from the request. C is to ask a specialty trainee, which is a bit senior doctor than you are in the team, to discuss the request with the radiologist, to ask them to discuss, or call your consultant to inform her that the radiologist has rejected the request, because if it's rejected, then you have to inform someone, or you have to do something from this list. Ask your consultant to return to your ward so you can explain the situation. So in this scenario, obviously the main rationale of thinking is ensuring patient safety. So obviously the consultant have decided the patient needs to have a CT scan, but there is a communication gap between the consultant and the radiologist, and you are the media. So you have not provided sufficient information, and that's why the radiologist has rejected the request. Now, what would be the most appropriate thing to do? The most appropriate thing to do would be to ask the radiologist to explain what more information does he need for this patient to have the CT scan done. Then you can actually go back and ask the consultant or even know about the patient more to provide him more information. That would be the most appropriate response. The second thing could be that you can ask your specialty trainee because they might be more experienced or they might already know about this patient from the consultant that they have seen in another ward. So they can speak to the radiologist regarding this. The third appropriate thing would be you can call your consultant and say that the radiologist has rejected and the consultant can just take it from there. Or the fourth would be you can ask the consultant to come to ward and you can explain the situation there if the consultant is busy somewhere else. The least appropriate would be is referring to another radiologist because the another radiologist will do the same thing again. They will just reject it because it's insufficient information, and that's the least appropriate thing to do. So this is the kind of ranking questions you will face in situational judgment test. Another type of question, it could be given a situation and you'll be asked to choose from some of the options which you think is most appropriate. Let's run you through that type of question again. So you are undertaking a very busy night shift and started your only break for the evening 1 minute ago. A nurse approaches you to inform you that she's very concerned about a patient and wants you to see him urgently. She tells you that the patient has a fever and she suspects that he has pneumonia. When you ask for details for further observations, she cannot remember any information about the patient's heart or breathing rate, but she notes that the patient looks very pale and unwell. Now, the question is you have to choose the 3 most appropriate actions to take in the situations. And the options are: finish your break at the time you had planned, completely ignore the whole scenario. You can bleep the specialty trainee to request assistance. So in this here, bleep is like a pager that all the trainees of on-call would carry. You can call the switchboard and give them the bleep number. You can bleep your extension in their pager so they know that you're looking for them. They can call you back on your extension number phone. Number 6, finish your break immediately. That would be one of the actions if you choose it. Administer antibiotic to the patient to treat pneumonia. You don't know the patient has pneumonia. It's the nurse just suspecting the patient has pneumonia. Ask the nurse to gather the patient observation because when the nurse came to you, she couldn't remember the patient's observation. Ask the nurse why she suspects the patient has pneumonia. You can have a conversation about the patient with the nurse. Explain to the nurse why it is important to take a break during night shift. Okay? And the lastly is assess the patient. So by looking at all these options, you have to find out which 3 are the most appropriate actions. Here, the same thing, it's about patient safety, and sometimes patient safety, not sometimes, I think patient safety comes first above all, even if it's inconvenience to you. So if you're on a break, but a patient is unwell and you are the only doctor around, you'll have to go see the patient. So out of all these options, the appropriate answer would be obviously you have to finish your break immediately. You have to ask the nurse to find the observation, what are the actual observations are, and go assess the patient. And after that, if you think that the patient has pneumonia, then it's up to your judgment whether you want to discuss this with the specialty trainee first before starting them on antibiotics or giving them treatment. But these are the first 3 things you have to do in this situation. So I hope that you have an idea about how the situational judgment test questions are. So all of these questions, as I said, there are 2 practice papers on UKFP website. You can go and look at the questions, and the answers are already there as well in a separate document. You can find a lot of practice modules for situational judgment test online for free as well. If you just read one of those books that explains more about those different situations categorically, you can prepare well for this exam. Now the next exams that we have talked about as a part of the whole application process is PLAB. In this video, I'm not going to discuss in detail about PLAB because we have already made an extensive course on PLAB where there is everything, detailed discussion, overview of the PLAB exams, understanding what is GMC registration, requirement for the PLAB exams, opening a GMC online account, what happens after a PLAB. So all about PLAB has been discussed in this course, which you can find in our Road to UK Academy. If you have some time, I would suggest that you take some time out and watch those videos to understand how the PLAB exams is structured and how can you prepare for it and how you can take it. The next exam that may come for some of the applicants for UKFP, not many, is one separate, which is called clinical assessment. It's a national clinical assessment. It's only applicable to those who have graduated 2 years prior to the program that they're applying for. So if you're applying for a 2022 program on August, but if you have graduated before 2020 August, then you may have to take this national clinical assessment, and you will know whether you'll have to take it or not once you apply for the eligibility application. It's an OSCE exam, 16 station, and this is very similar to PLAB 2, but unfortunately, even if you take this clinical assessment, you will have to take PLAB 2 as a part of the GMC registration, because this clinical assessment is a part of UKFP application process, and PLAB 2 will be a part of GMC registration process. So these are completely separate. But if you have to take clinical assessment, you will know from the onset when you are applied for eligibility application in the beginning of the whole process. The cost of this exam is £850 per candidate. Now, as we're talking about cost, let's break it down how the whole thing may cost. So this might look similar or familiar to you if you have seen the other video where I have discussed about the application timeline. So as you can see, if you have taken your final exam in February and you got your pass results in May, you can actually apply in that year to start your UKFP in the next year, August. So as you can see, the paperwork ready and have to be signed by July so that you can apply for eligibility during late July and August time, by which your IELTS and OET have to be passed as well. And the national application window will open during October, mid to November, and November would be the last time you take PLAB. So I'm saying the last time because if you have taken PLAB on already before all of this, that will also work. So let's talk about the cost in this video. So if you want to take IELTS, the cost would be around 170, or if you take OET, the cost will be £320. I'm putting this in June because thinking that you haven't taken yet, but obviously if you take IELTS or OET in January, February, March, it doesn't matter. You just have to have it passed and have the required score before the eligibility application in August. And there might be some cost involved in preparing the paperwork because you may have to get some statement of comparability of your primary medical qualification that you have obtained from a UK organization like UKENIC. That might cost £50, but it's completely variable because it honestly depends on where you have graduated from. Then comes the cost for PLAB 1 exam. During that time you may have to book PLAB 1, which costs £240. And SJT does not cost anything. It's free, and you will be allowed to book SJT if you found eligible and during the whole application process when you applied during the national application window. You will be given a link where you have to make an account and book your SJT exam. They have 2 SJT windows, the December and January. Whichever you take, you don't have to pay for this exam. Now you have to think about booking PLAB 2 once you have the PLAB 1 pass results in January, and the PLAB 2 booking will cost you £879. And obviously you may have to come to the United Kingdom to take PLAB 2, so that involves the whole the visa application and staying in the UK, which is completely variable from different parts of the world. But as a rule of thumb, I think if you stay in the UK for this exam, you might have to spend at least £500 for renting and living and eating and all the other stuff. And obviously added cost if you are how much is the visa cost for you, so you have to think about that. But I think nowadays within 3 months or even 2.5 months you can get the PLAB 2 done, because you don't have to stay after PLAB 2 is done to complete the next process, because all of the next processes can be done online. So as I said, after you got your PLAB 2 results, you can apply online for GMC provisional registration, which will cost you £52, and the rest is EPIC verification, which you have to completed previously. You apply for GMC registration, so that might be variable as well. And once you got the provisional registration and an offer from UKFP that you are starting the job in August, with that offer letter and certificate of sponsorship, you can apply for skilled worker visa, which will cost you £464. And before you come to the UK, this is just an amount that we say that you might need for the first month to settle down, to pay the rent, to find a place to stay, eat and drink, because you'll not be paid until you finish your first month of work. So this is just the start of money that we say that you might need when you come to the UK to start your job in August. So looking back, if we totally add all of this and include all of the expenses, starting from taking IELTS or OAT to submitting the eligibility application, from taking PLAB exams, staying in the UK for at least 3 months for PLAB 2, applying for GMC registration with EPIC completed, getting a skilled worker visa and applying for that, and some startup money in the UK, you would be looking at a total of £5,000 to £5,500. It might look like a lot, obviously it is a lot of money, but as I described in the previous slides, you don't need that money at once. You need that money in separate occasions. You need that money in specific time of the year. And I hope that with my timeline explanation, you can map out when the cost will be and when you need the money at hand and for what. There you have it, the explanation of different exams and how much the entire pathway to UKFP might cost. And if you have any questions regarding the whole process of application for United Kingdom Foundership Program, feel free to ask in the comments below. We're always happy to answer. And if you have not already, please subscribe us on a YouTube channel, follow us on Facebook, Instagram, and Twitter, and have a nice day. Thank you.